We have in place right now a by-name national list of veterans who have experienced homelessness. Any given night, there may be 36,000, which is what was consistent, but it's not going to be the same 36,000. There's an aging homeless population that poses significant challenges and issues. We've seen an increase in women veterans who become homeless, in part because of the number of women veterans that have increased as well. Blueprint that USICH has developed.
Sir, that's not what I asked you.
Okay, please.
I've asked you twice now. Is there a study that you guys have done to look at the causes of veteran homelessness?
We can take that as a due out. There are a lot of studies.
That is a wholly unacceptable answer, man. So which study do you trust? Who did the study? Do they have equities involved? So if we can't figure out why they're homeless, how in the hell are we going to help them not get there to begin with? What I want from you is a list of the different groups in these 84 individual communities that have reached functional zero so that we could take that as a basic model and apply it to the other communities that have not reached functional zero.
What I want to do is give you the floor for just a second to explain how VA's data backs up that budget and what assurance you can provide us that that $3.2 billion is being put to its best and highest use.
Thank you, Congressman Levin, and I appreciate the question being raised. It is a very generous budget. We are very appreciative of Congress's support for us over these years through this initiative and for the oversight and holding us accountable. These are taxpayer dollars. We need to be good stewards of them. I think it is extremely important, and I want to provide some clarification, particularly to your chart, and I think to provide some backstops to some of the points and considerations it raises. VA serves significantly more veterans than the 36,000. Our job is to prevent individuals from becoming unhoused and homeless. Our job is to quickly rehouse them when they do. Our job is to move them into permanent housing, and our job is to keep them in that housing, which includes providing the necessary supports, the necessary care, and the necessary services that they need so that they can stay permanently housed and really return to their lives and livelihoods and potentials they have before them. As you know, the 36,000 veterans identified in the PIT count reflects really an incident count. It's a snapshot view, as you've noted, of how many veterans are identified on a given night in January, either in our emergency shelter system or in a street count. I'm not going to try to defend or deflect challenges and limitations to the counting process. It's something that has evolved, and there are always efforts to improve upon that. But what I will say is that it does not measure how many people are going to be homeless the next day, the next week, or the next month. And data from the Continuum of Care HMIS system has consistently shown that the actual number of homeless over a year's time tends to run 4 to 5 times higher than that PIT count from that given night. So that it unfortunately misrepresents the full scope and need of homelessness that we're seeing across all of our communities.
So Dr. O'Toole, how close is VA to having a national by-name list that shows each veteran experiencing homelessness, and please use actual time frame, months, weeks?
So the by-name list is a game changer for us, and let me be very clear, it is essential from going from aggregated data to actionable data to be able to have that by-name list. We have in place right now a by-name national list of veterans who have experienced homelessness who are part of the VA system. What we are working on currently, however, is making sure that—
He's got his gavel. Give me the time. How long?
We are beta testing the capacities to be able to interface with the community
Months,
continuum
weeks?
of care by the end of this calendar year. We will be beta testing it.
Thank you. Yield back.
I was looking at Mr. Levin's chart there, and sir, were you saying that on average, on any given night, that number could be around 150,000 veterans that are homeless. Is that what you were saying?
No, sir. On any given night, there may be 36,000,
Okay.
which is what was consistent, but it's not going to be the same 36,000. And so it is
I thought you said it was 5x that number.
right, over a period of, so the incident count is a snapshot that looks at homelessness on that given night. The individuals who are homeless may change. And there is an influx into homelessness and efflux out of homelessness into doubled up arrangements. So collectively, if you look at all of the individuals who experienced homelessness over that 12-month period, it's going to be 4 or 5 times higher than the 36,000 counted on that one night.
What kind of trends are you guys seeing when you look at this demographic? Are you seeing regional trends? Are you seeing service-specific trends? Can you enlighten us on any trends that you guys are seeing?
Well, clearly our challenge points are in communities that have some of the most difficult and tightest housing markets. You know, as we all know, different parts of the country have seen the stock of affordable housing dry up, and it becomes extremely difficult. And we're seeing increases in the homeless communities in those settings very much. We have subpopulations of homeless that we are tracking and working diligently to try to address. There is an aging homeless population that poses significant challenges and issues. We've seen an increase in women veterans who become homeless, in part because of the number of women veterans that have increased as well. But this is a significant and concerning issue, particularly those who are unsheltered and a few others.
Mr. O'Toole, has the VA done a study to illuminate the major causes of veteran homelessness?
I mean, it's the VA and academic affiliate organizations around the country and world have been looking at how to end veteran homelessness.
Is there a study that you guys cite and use?
We know that housing is the solution for homelessness. We know also that it needs to be housing with supports. And that is the strategy that we follow. I think the blueprint that USICH has developed.
Sir, that's not what I asked you.
Okay, please.
I've asked you twice now. Is there a study that you guys have done to look at the causes of veteran homelessness, like drug abuse, living under the poverty line, not having affordable housing in your region? Is there a study that you guys use and can cite or provide to this committee?
Thank you, Congressman. We can take that as a due out. There are a lot of studies that we use and reference, and I'm happy to provide that to the committee.
Okay, so in the please do that, sir. In the $3.2 billion that you were talking about, I think you mentioned healthcare, mental health, job employment are 3 of the big focuses. Was there anything else in that?
Yes, sir. There are prevention and our prevention services through the SSVF program, Supportive Services for Veterans and Families, is a huge issue and has a significant impact for our veterans. Providing permanent supportive housing and the case management support for those veterans, providing outreach through our outreach team stand downs, providing transitional and just-in-time housing would be the other bucket that I would want to emphasize beyond that.
Do you guys see a segment, sir, even if it's a small segment of veterans, that even if you were to provide them programs to help them find a job, even provide them housing, that just don't want to live traditionally and just want to, be out on their own? Is there even a cross-section of veterans that you find that are in that boat?
Congressman, I've been working in this space for a long time, providing direct care to veterans. Yes, there definitely are some. I couldn't give you quote you a specific number, but I would also tell you that, motivation changes. Situations can impact motivation. And somebody who may say that they don't want to move out of an encampment this week, they may change their mind the following week. And our job is to continue to be there and be available and be with them and encourage them to make those changes.
Mr. Chairman, can I have one more question?
Please do, Mr. Crane.
What about addiction, Mr. O'Toole? You see any correlation with veteran homelessness and addiction?
Yeah, absolutely. Substance use disorders, addictions clearly correlate. It's not necessarily the majority of homeless by any stretch. And I think that's an important emphasis point, as with mental health. But we see roughly 40%, 30 to 40% of individuals with active addictions when they come in, and providing for them the treatment that they need is critical to their pathway to sustainable permanent housing.
And I want to, Mr. Crane, I'd like to get with your staff when we're done here, and potentially Mr. Levin, and we'll do it first. That is a wholly unacceptable answer, man. So which study do you trust? Who did the study? Do they have equities involved? So if we can't figure out why they're homeless, how in the hell are we going to help them not get there to begin with? So, Mr. Crane, if you're okay with that, I think we've had experiences with the VA before, Mr. O'Toole, not you in particular, but we've learned in the 7 minutes that Eli and I have been in Congress that if we don't tell you to do something, it's not going to happen. So let's figure out, Mr. Crane, something to figure out a way to direct that, because we need to have that data, and that dovetails perfectly with what the ranking member was saying about having actual, real data. Is that right, sir? Mm-hmm. Okay, so we're good. All right, I now recognize myself for 5 minutes. Mr. O'Toole, you have a budget of $3.2 billion. How many employees do you have?
There are 6,800 employees that work within the homeless program office, providing services
Roger that.
Into the community.
I got it. I was just asking for a number. What's the average pay grade?
I do not know that off the top of my head, sir. We'll have to do a due out.
Have you increased your numbers of employees since 2022?
Yes, we have, sir.
By what factor?
We are I do not know by what factor. We strive for a 90% employment rate, and we are currently in the high 80s in terms of filling our vacancies.
Let's say you had 100 employees in 2022. Now you have like 110 or okay. So we're spending $3.2 billion, $90,000 per homeless veteran. You've increased your manning, your administrative staff from 2022, and since then the veterans' homeless rate has increased. So that dog does not hunt. This is not okay. We're spending money on administrative people, bureaucrats, and not on veterans. And we're not getting a return on investment. The return on the investment is not a monetary thing. It's a homeless veteran not killing themselves or becoming a drug and alcohol addict and committing a crime and then starting this downward spiral of permanent incarceration, which we need to end. When you approach this problem set, and that's exactly what this is, do you have a plan for a continuum for individual veterans, meaning veteran enters program, veteran exits program?
Yes, sir. Well, may I first clarify, the 6,800 employees are direct service care providers. These are not administrative positions. Secondly, yes, sir, one of the efforts...
Well, so hold on a sec. So you've increased care providers, and you still, homeless veterans are increasing, so what's the difference?
Well, I'd like to, if I can, clarify or at least amend one of the observations there. Yes, the point-in-time count did increase, and we fully accept that and are working for it. It is not acceptable. The increase among veteran homelessness was actually much less than the increase in the general population. There are a lot of factors that go into that increase, and I fully acknowledge that, and that's another discussion, and happy to spend the time going into those factors.
Okay, so do you have a plan for each individual veteran, a continuum of care, veteran enters program, veteran exits program?
Yes, we do, sir. This is
and
part
what
of
does exit mean to you?
Exit for us can reflect one of two things. Permanent supportive housing, or those supports are continuing to be needed, but
they're still involved in a program because
they are still involved in the program because they may have ongoing care needs, mental health, substance use, disability management, and so forth.
So Mr. O'Toole, where I come from, that's not an exit, sir.
Okay.
That's just a different involvement in a program. So what percentage of the veterans that we're helping, that you're helping with your 6,800 employees, go on to work in the civilian sector where they're actually not part of the government? Because we can wind up hiring the entire population. That's called communism. And I'm not implying that you're a communist or that Steve's a communist. I'm saying that when universal governmental employment is taking place, that's a different system of governance than we live under. So what percentage of your veterans that are participating in this program are getting jobs in the private sector?
That will have to be a due out for us to give you those specific numbers, but we do have about 10% of our population every year leaving the HUD-VASH program because their personal economics and their income prices them out.
That's awesome. And that's a good thing. Mr. Olivet, 84 communities have gotten to functional zero. That is an incredible accomplishment. What percentage of those communities, or excuse me, what is the difference between those 84 communities and other communities that are not at functional zero?
I think what we see as common across those communities is very, very close collaboration, where there are strong local nonprofits working with strong VA leadership at the local level and making very efficient use of the resources, both VA and private resources. We also see a real commitment to housing, getting people into housing as quickly as possible so they're not languishing.
Mr. Olivet, my time has expired. I just asked the ranking member to be cool with it. I'm going to yield myself an additional 2 minutes. Please continue with your answer.
Thank you. The commitment to housing is fundamental. So when we see communities emphasize housing, I was in Dallas last month and met with a number of leaders, met with a number of people who are in these programs.
Mr. Olivet, you're saying that the 84 communities that have reached functional zero have a higher level of coordination in between these different agencies than other communities?
I certainly think that's one of the ingredients, yes.
Okay. What percentage of these organizations that are communicating with each other better than the rest of the nation are faith-based?
It would be hard to quantify that number, but what we do see is that the faith-based community has a very strong role to play in this work.
So do you actually have a list of these different entities within the 84 communities that are coordinating better to each other that have reached functional zero?
A list of the local agencies working on it? I'm not sure that we have a comprehensive list for every community.
Okay. If you find a winning team, you look at the composition of the winning team, sir. So what I want from you is a list of the different groups in these 84 individual communities that have reached functional zero so that we could take that as a basic model and apply it to the other communities that have not reached functional zero. Because it just seems like we're shooting in the dark here. And when Mr. Levin says he wants data, that's real data. So we want to get to functional zero. 84 communities have. The other thousands of communities haven't, including Camp Pendleton, San Diego. Mr. Levin, he's got a beautiful district. He represents Camp Pendleton, home of the Marine Corps. I mean, they're bad. I mean, good dudes, right? They are. I love them. No one will besmirch the glorious Corps in my presence. So let's see if we can get the models from these 84 communities to his district. So I want that from you, sir, and let's look at this collectively.
I realize this is a committee hearing about veteran homelessness and what we can do to prevent that. We talk about policy, we talk about technology, funding, housing, investment, healthcare, data, all these different things. I think all these things are great. I'm going to be honest with you, though. One thing, I think in many ways, one of our biggest problems is we don't actually get to the root cause. And that's why I was disappointed when I asked the panel before you guys, do you guys have any studies that you've done to actually look into the causes of this, especially when we're talking about numbers like $3.2 billion that this Congress, through the American people's hard-earned tax dollars, are going to be devoted to this cause. I want to read you guys a verse real quick. It's Matthew 11:28 through 30. It says, "Then Jesus said, 'Come to me, all of you who are weary and carry heavy burdens, and I will give you rest. Take my yoke upon you. Let me teach you, because I am humble and gentle at heart, and you will find rest for your souls.'" The reason I read that to you guys is because when I got out of the military, I'd done five deployments. 3 of them were combat deployments with the SEAL teams. And yet I realized many had done way more than I did. Many have given up way more than I did. But I was like this verse. I was tired and I was weary and I was pissed off. And I had survivor's guilt. And I was angry at the world. And the best thing that I ever did was I went to a Christian men's retreat that I didn't want to go to. And I'm not saying that's the answer for everybody, I'm not. But I would love to see us do a better job of actually addressing some of the issues that I believe can only be dealt with when we actually look at people's heart and some foundational stuff like faith. Why don't we talk about that when we talk about veterans homelessness? Because why don't we talk about that when we talk about some of the causes that lead to veterans homelessness, like addiction? I believe what Dr. Randy Withrow, sir, you said something on the panel today. You said it's not always about not having a house. Didn't you say that, sir? I agree with that statement. I really do. And just because it worked for me doesn't mean it's going to work for everybody else. But when we're talking about a sum like $3.2 billion, I'm worried that sometimes we just throw money at things without attacking the real problem and getting at the root cause. And I'll tell you this right now, if it worked for me, it'll work for some other veterans out there. And so I just wanted to say that today because I do care about my brothers and sisters, regardless of what service they were a part of, regardless when they served, what their job was. But I know from experience that for a lot of them, they're weary, they're heavy burden, they're pissed off. They saw things that most human beings should never see or do. And sometimes giving them a house isn't going to fix what the root cause is. And so I just wanted to say that today. Thank you, Mr. Chairman. I yield back.
Mr. Crane, the gentleman yields back. Mr. Crane, I want to thank you for that, and I would like to associate myself with your comments. We had hoped that we would have Hope Ministries here also. Unfortunately, I was not able to travel here. I used to work with something called the Mighty Oaks Warrior Foundation, and they address the root issues. The true upstream cause of many of these issues is the wounds that we have on our souls.
Mr. Chairman, I looked up, I did a quick search on it. I found easily 20 or 30 in faith-based ministries for veterans, and they're not all my faith, they're across the board, but I think that's something that we should maybe look at in the future, doing a hearing on something like that, Mr. Chairman. Thank you.
Ms. Haggerty, what's your budget?
$24 million.
How much of that is government money?
None.
0. Okay, so that would make 100% private. Mr. Carville, what's your budget?
25 million.
25? How much of that is government?
Roughly 70% from the federal government.
70%. Okay, Mr. Withrow?
We roughly get from the WDVA right at about 8 million.
So your total budget is 8 million?
Right.
And it's 100% government?
Yeah.
Okay. Mr. Wood, what's your budget?
To be honest with you, sir, I am not sure.
Okay.
I know that a vast majority of it is government money.
Okay. So, Ms. Haggerty, would you consider your organization to be effective?
Very, sir.
Okay. Mr. Carville?
Extremely.
Mr. Withrow?
Mostly.
Excuse me, Doctor. I apologize. Dr. Withrow.
Mostly.
Very well. Mr. Wood?
Yes, sir.
Okay, so I think just by this little mini cross-section here, from 0 to 100% government funding, we can say that the effectiveness and the efficacy of these programs are not based on government funding, right? I mean, because they're not. If you're effective and you're effective, and we have every little, we go from nothing to everything spectrum here. So I think that we need to look oftentimes externally to the government. I don't think that the government is the solution to these problems. I believe that we can be very effective in helping move the ball down the field, and again, that is functional 0. But I also think that we need to utilize some of these other groups and allow them to serve their people, their constituents. Without objection, so ordered. This hearing is adjourned.